The Nordic region should be the best place in the world for children and young people to live in. To realize this vision, we must develop good measures to improve mental health and well-being amongst children and youth. The Nordic Welfare Centre was given the assignment to organize dialogue sessions in the Nordic region and discuss how we can improve the current situation. How can we intervene at an earlier stage so that less children and youth suffer from poor mental health? To turn this around, the Nordic Welfare Centre used its broad network and gathered researchers, policy leaders and practitioners, youth organizations and civil society organizations to one-day workshops in 6 Nordic cities. Many topics were raised, and we listened to experts in the field, especially young people, since they are the ones who know what it means to be young today. The importance of a child and youth perspective is one of the most central issues that was raised. Being listened to and treated with respect is something fundamental, but somehow not fully implemented when we talk about children and young people. Trustful relations are characterized by respect and are necessary conditions for the activities to be perceived as something positive and strengthening. Many vulnerable youths have negative experiences with the welfare system and how they are treated. Therefore, we need a more positive and inclusive approach when helping children and young people, especially when it comes to dealing with mental health or other vulnerable issues. We need to help children and young people find their strengths and believe in their abilities. Children and young people want to have people around them who are rooting for and believing in them, because they, just as everyone else, want to be needed and be part of a bigger picture. School, another big concern. This is the place where we spend many hours and years growing up, transitioning from small boys and girls into young men and women. During these years, we form the children and youth of today, and during this time, we have thousands of opportunities to help and nurture the individuals who are getting lost. The number of children and youth who suffer from poor mental health is increasing in the Nordic region. Every day, teachers and school staff should focus and work on strengthening students' self-esteem. For example, by conducting regular interviews every year with all students from preschool class through the last year of secondary school, and by focusing on mental health as well as physical health. Research and experience-based knowledge has demonstrated that good and completed schooling is the most important factor for safety and well-being for all young people, but particularly for those who risk ending up in different types of exclusion or marginalization. During all dialogue meetings, the importance of mental health awareness was discussed. It was stated that the work with strengthening mental and physical well-being should be a concern for all professions in preschools and schools and should be a part of everyday work. The schools must also have time and resources to be able to develop and retain well-established cooperation with the health sector, social sector, and civil society. There are schools in the Nordic region that are hiring multi-professional staff so the teachers can focus on teaching their subjects. There's a large need for easily accessible support activities for youth who feel unwell but are not ill enough for the initiatives within the healthcare system. For some children and young people, it is enough to be able to make contact and connect with committed adults or young adults who have time to listen. Others require more long-term support, with, for example, psychologists or counselors. Every child and young person is different and requires different types of help and resources. To really take care of all young people without blowing the budget, we need to intervene at an earlier stage. While the Nordic Welfare Centre have detailed written summaries from all dialogue meetings, we will shortly mention the most discussed topics. In Reykjavik and Tórshavn, the importance of early intervention and better cooperation between different sectors were emphasized. In Maruyama, the discussion focused on the need of easily accessible support activities for youth who feel unwell but are not ill enough for initiatives within psychiatric care. In Drammen, the discussion focused more on the government's new Master Your Whole Life strategy for good mental health and the Norwegian initiative 0 to 24. It was underlined that promotion of positive mental health and good self-esteem must be better included in preschool and school work. In Stockholm, the focus was on school health issues and the importance of civil society as a complementary actor in youth work, focused on mental well-being. We see that the number of young people who experience poor mental health is increasing. We see that the number of school dropouts is still too high. We see that even though this issue is about young people, we don't let young people be a part of the solution. We need to let the real experts come forward and have a say, to come up with even more and better solutions than we, the adults, have come up with so far. The Nordic region should be the best place in the world for children and young people. This is the vision for the work with and for children and young people in the Nordic Council of Ministers. It is time to act. Join us on this journey and let us do this together.